Most people think strength is about lifting heavy things, big weights, big muscles, big effort. But after 60, doctors don't start by asking how much you can lift. They quietly watch something much simpler. They watch how you stand up from a chair. Not to judge you, not to label you, but to understand what your body is really saying. Because this one movement tells a deeper story than most people realize. Why standing up matters more than you think. Standing up from a chair uses more than just your legs. It needs leg strength, hip strength, core control, balance, coordination, confidence, all at the same time. Doctors know this. That's why in clinics, rehab centers, and physical therapy rooms, this movement is often watched closely. Not because it looks impressive, but because it reveals how well the body is working as a whole. If this movement becomes hard, the body is not failing. It is asking for attention. What doctors notice that most people miss. Doctors don't just look at whether you stand up. They notice, do you push evenly or lean to one side? Do your knees shake? Do you rush because you feel unstable? Do you use your hands without realizing it? Do you hold your breath? These small details help them understand muscle weakness, balance issues, joint stress, fear of falling. It's not about being weak. It's about how safe your body feels while moving. The emotional side, nobody talks about. Losing the ability to stand easily doesn't just affect the body. It affects the mind. People often start to feel slower, dependent, invisible, frustrated, less confident. Some stop going out. Some avoid social events. Some hesitate to ask for help and suffer quietly. Doctors see this too. That's why they care so much about this movement. Because regaining it doesn't just restore strength, it restores self-trust. What this test really means. This chair test is not a competition. It doesn't mean you are old, you are weak, you are done. It means your body is changing, and change can be guided. Doctors understand something important. Muscles don't retire. They respond to use, even later in life. The good news, doctors share. Here's the part many people don't hear enough. This movement can be improved. Even after 60, even after 70, even after 80. Doctors and therapists see people regain this ability every day. Not with extreme workouts, but with consistent, safe movement. The body adapts when it is used gently and regularly. Why speed is not the goal. One mistake many people make is trying to move fast. Doctors often say, speed hides weakness, control reveals strength. Slow movement builds real muscle, improves balance, protects joints, builds confidence. Standing slowly and sitting slowly is more powerful than rushing. How doctors recommend practicing this safely. Let's talk about what doctors usually suggest. In simple terms. 1. Practice the movement itself. Sit on a sturdy chair. Feet flat on the floor. Stand up slowly. Sit down with control. That's it. No fancy equipment. If needed, use your hands at first. Use a higher chair. Take breaks. Progress comes from repetition, not force. 2. Strengthen the supporting muscles. Doctors often suggest simple exercises that support chair strength. Chair stand, wall-supported squats, step-ups using a low step, heel raises holding a chair. These movements help thighs, hips, calves, core stability. No gym required. 3. Balance is part of strength. Standing up isn't just about muscle power. Balance matters. Doctors often recommend standing near a wall or counter, shifting weight gently side to side, practicing standing on one leg for a few seconds. Balance improves with practice at any age. 4. Move more during the day. Doctors notice that long sitting makes this harder. They often suggest standing up every 30-40 minutes, walking around the room, light movement between tasks. Small movement adds up. Why consistency matters more than effort. Doctors don't expect perfection. They expect consistency. 5 minutes a day is better than one long session once a week. Consistent movement can restore strength, reduce fear, improve confidence, protect independence. The body responds best to gentle reminders, not sudden demands. Listening to the right signals. Doctors often say, mild effort is healthy. Sharp pain is not. Discomfort that fades is normal. Pain that increases should be respected. Progress slowly. But don't avoid movement out of fear. Avoidance weakens. Movement heals. Why this test is about freedom. Standing up from a chair is not about impressing anyone. It's about getting up on your own, using the bathroom safely, answering the door, sitting with family without fear, living with dignity. Doctors understand this deeply. That's why they care. A message. Doctors want you to hear. You are not broken. Your body is communicating, and communication can be answered. Strength after 60 is not about pushing harder. It's about moving smarter. A simple daily promise. Doctors often suggest making a simple promise. I will move a little today. Not perfectly, not aggressively, just consistently. That promise protects more than muscles. It protects independence. The bigger truth. This chair movement holds a powerful truth. When your body responds, your mind feels safer. Movement becomes easier. Life feels more open again. Final thought. Doctors don't watch this movement to judge you. They watch it because it matters. After 60, strength is not about youth. It is about freedom. And freedom often begins with something very simple. Standing up.